Welcome back to Health Up on Newsroom Africa, where we're going to talk further about vaccine hesitancy in South Africa with COVID vaccinations. And in the studio today, we have someone with us, Kanya Ndaki, who was vaccine hesitant but then decided to get vaccinated after all. Kanya is the Communications Director of the AURUM Institute in Johannesburg. Kanya, welcome, and thank you so much for coming to share your story with us today.
Thanks for having me, Mia.
What were your fears about vaccines?
So I had COVID previously, and it hit me really hard. You know, the whole 9 yards, hospital, rehab afterwards. So with all of that ordeal, I was really concerned about the side effects. I thought to myself, I've had COVID, I'm worried about the side effects, how it's going to interact with my body, how the side effects are going to affect my comorbidities, and also with all the long COVID symptoms that I was struggling with. I thought to myself, these side effects could also just cause havoc, more havoc. So I was really concerned, I was scared, basically.
So what then changed your mind and made you decide to get vaccinated?
So, you know, my friends, my colleagues, my family started taking the vaccine, and everyone was so open about, you know, the side effects, the process. There wasn't really a huge conspiracy or any, you know, fearful things that happened after they had taken the vaccine. So then I thought to myself, maybe it's not so bad. But I think for me, the cherry on top was my daughter saying, if Granny can take it, why can't you? And my mom is a 68-year-old healthcare worker. She took it in the morning, and then, you know, in the afternoon, she had her shift and she went back to work. And she didn't have any side effects. So that really pushed me, and I thought to myself, okay, let me try, let me actually go and confront my fears.
So tell us about your vaccination. Which vaccine did you take, and did you have any side effects?
Yeah, I mean, I took the Johnson & Johnson vaccine. I prepared myself. I took it on Friday, thinking I was going to, you know, have all these side effects over the weekend. But surprisingly, yes, I was tired. My arm was painful. I took some Panado, but I was fine. By Sunday, I was up and about. So yeah, it was a bit of an anticlimax.
So Kanya, if I have to talk to a family member who is a bit vaccine hesitant, how should I talk to them? What worked for you? What were the aspects that worked?
So I think the most important thing is empathy. You've got to really put yourself in people's shoes, because people are scared. So don't dismiss their fears. I think people are really scared about the side effects. It's the fear of the unknown. So arm yourself with information to be able to deal with it. Don't dismiss them as crazy. And I have a lot of family members, friends who are still grappling with all of that. So my experience is not unusual. But I think the main thing is empathy.
Thank you so much. And that's such a great thing to say, empathy and don't judge, Kanya. That was really useful advice, and it was wonderful to hear your story. That was Kanya Ndaki from the AURUM Institute in Johannesburg. She spoke in a personal capacity today, but she was vaccine hesitant and then decided to get vaccinated. Now, this is, of course, also a question that many researchers try to answer. What's the best way to approach someone who is vaccine hesitant? And we have one of those researchers that we're going to speak to today. That is Professor Chales Wiysonge. He is the director of Cochrane South Africa at the South African Medical Research Council. Professor Wiysonge, welcome. Thank you for joining us on our show. We've heard from our previous guest that empathy is really important when you speak to someone who's vaccine hesitant. What does the research say?
Thank you so much, Mia, for inviting me to have this conversation with you. Yeah, just for a start, let me just tell you that I am vaccinated, and everybody in my family who is 18 years or older is vaccinated. And most hesitant people, like your previous guests, are ordinary people with specific concerns about vaccines who just want to make the right choices for themselves and their families So listening respectfully to their concerns is very crucial. And I agree with your previous guests that it is important to have empathy when you speak to vaccine hesitant people. Scientists like us are used to looking for very high certainty evidence and presenting it with precision. However, evidence is not enough in itself to reduce hesitancy. In many instances, empathy is more persuasive than evidence. And I agree very much with what your previous guest said. Secondly, it is important that we consider the context. Vaccine hesitancy in some communities is mediated by experiences of marginalization and exploitation. So to adequately address vaccine hesitancy in such a community, we must take the time to understand the reason for the hesitancy and to know the context where it comes from. We may not always agree, and that is okay, but we must start with the humility to understand the context. And the third thing I want to say is that we need to validate strengths. We should begin the conversation with a vaccine hesitant person by saying that it is admirable that someone cares so much about their family and wants to make the best choices for them. For example, if someone were to say that on a scale of 1 to 10, that their willingness to take a COVID-19 vaccine is 3, you should congratulate them and say that it is fantastic, that it is not 1 or 2. So this positive approach makes a person more receptive to information. And once a person feels heard, when the person feels validated, and once a person feels understood, he or she is likely to listen. I think those would be the main tips that I would give about talking to a vaccine hesitant person. And of course, empathy is very important.
That was Professor Chales Wiysonge from Cochrane, South Africa at the South African Medical Research Council. Thanks very much for sharing your thoughts and your tips with us, Professor Wiysonge. And if we reflect on that interview, I think the main takeaways are have empathy, acknowledge the context of someone's fears, and also let them feel validated and don't just dismiss what they've got to say.
Well, some of the things that we wanted to talk about certainly was statistics, Mia. Certainly those numbers and how they're looking.
Yes, the big question, of course, is do we have enough vaccines in South Africa at the moment to give everyone who needs vaccines a jab? And the good news is that we now have received 34 million doses of vaccine so far. So that is a combination of Johnson & Johnson and Pfizer doses that we've received. Some we've bought, some we got via COVAX, which is a procurement mechanism of the World Health Organization. And if we look at how many of those doses have we used so far, it's just under about 12 million doses. It means we've got 22 million doses left in South Africa for use. And on average, on a weekday, we use about 260,000 doses. So if we look at for how long those doses will last for us, it's round about 84 days. But important to note that there's about a 10% wastage. We sometimes lose some of those doses because they come, particularly with Pfizer, they come in vials in which there are 6 doses, and sometimes we only get 5 doses out of those vials. But the good news is we do have enough vaccine doses in the country for at least 2-3 months to work with, and we are getting many more doses in.
Yeah, the last few weeks, in fact, I was one of those people that was pretty hesitant about getting the vaccine. And at some point, I then decided, after my daughter, as your guest, had a similar conversation that, I need to get vaccinated. But over the last few weeks, where I've been trying to convince people to get vaccinated, haven't done it very, very successfully. What are some of those words of advice that you would give on how do you convince someone to get vaccinated? I know we had a little bit of that in that conversation a little while ago.
We still actually have Professor Wiysonge on the line, and I'm going to ask him that question. Professor Wiysonge, I'm vaccine hesitant. I feel I have lots of fears about side effects, and I'm concerned that vaccines might change my DNA. Convince me to get vaccinated.
Hello, Mia. Thank you for sharing your concerns about COVID-19 vaccination with me. This and other unfounded information about COVID-19 vaccines are circulating on social media, but these are all false. COVID-19 vaccines cannot change your DNA because the vaccine does not enter the part of the cell where the DNA is found. Personally, I have taken the COVID-19 vaccine. I want to be there for my children. I want to make sure that I do not contribute to any new variant of COVID-19. And variants, as you know, are types of COVID-19 that could be getting more and more deadly if we do not stop this spread through vaccination. And I understand that you are not sure if vaccines, COVID-19 vaccines are safe. In South Africa, I must assure you that we have very strict laws and regulations that make sure that any vaccine and any medicine for that matter that we use in our clinics are safe and they work. The vaccines authorized for use in South Africa, they are safe and they work. After you get the vaccine, you might have some side effects for 1 or 2 days, like we do with other treatment like ARVs, TB medications, and even paracetamol. We do have side effects, but we make sure that any vaccine that is authorized for use in South Africa or any medicine is safe and it is effective. And I can assure you that COVID-19 vaccines cannot change your DNA because the vaccine does not enter the part of the cell where the DNA is.
Thank you, Professor Wiysonge. I think that would convince me to get vaccinated. Hugo, would you be convinced by an explanation like that?
Oh, absolutely. I most certainly would. And I think he's explained it in ways that make it understandable for the average person out there, which is really what we're trying to do.
So, Professor Wiysonge, one more question. So if we look at what some other countries are doing, some countries have lotteries that people who get vaccinated can enter to get vaccinated. And we've also seen here in South Africa some shops offering discounts to vaccinated people. What does the research say? Do these strategies work?
Yes, thank you for that question, Mia. Yes, for other vaccines, we have limited evidence that when children or their parents are provided with incentives, either in form of cash or in form of gifts, there is a slight increase in the number of children who take up vaccines. We know that our people in South Africa have been severely affected by COVID-19 vaccine, COVID-19 pandemic, and their painful reality should be at the center of any vaccine rollout. There are some who need to get that extra push in terms of incentives to be able to get to the vaccination site. So I commend everybody who is providing such incentives. But the best incentive is to be alive. And vaccination is one of our surest ways to beat this pandemic.
Professor Wiysonge, thanks so much for sharing your thoughts and also what research say with us. That was, again, Professor Chales Wiysonge, who is the director of Cochrane South Africa. Hugo, the main takeaways, I think, is, and also something to think about, is that most people who sit on the fence about whether they want to get vaccinated or not can indeed be convinced, because a very small part of people who don't want to get vaccinated are anti-vaxxers who are just downright against vaccines. We've seen from Kanya and we've heard from the professor that if you have empathy and if you're honest, because honesty builds accountability and it builds trust. If you're honest about things like side effects, you can help to convince people to get vaccinated.
Mia, well, this has been another exciting edition of Health Hub number 3, and I'm sure there are millions of people that are watching and want some insight into certain topics. How can they reach you? Obviously, I know there's a lot of research going on and preparing for the next show and the shows after that. How do they find you?
So the best way to find us at BECCISA is to email us at health@beccisa.org, and they can also go to our website where we have lots of videos, particularly about the side effects of vaccines, that explains it in a really easy way to understand what are rare side effects, what are severe side effects, and what are just the common things like pain at the site of the injection that you could experience after getting vaccinated.
Always informative. Thank you very much, Mia. And just like that, we bring things to a close on the Health Hub for this week. Remember the appointment at 9 a.m. on Newsfeed AM for the Health Hub. BECCISA's Mia Malan will be back next week to give us the latest health insights.